The Brain Injury Guide and Resources is a tool for professionals, community members, and family to understand traumatic brain injury, as well as how to promote better living for those who live with a TBI. In this interview, we will talk with Dr. Tom Martin, neuropsychologist in the MU School of Health Professions, Department of Health Psychology, to learn about the issues surrounding veterans who have suffered a traumatic brain injury. And Tom, thanks very much for being with us. We appreciate it.
Thank you. I'm happy to be here.
What are some types of brain injuries that are unique to people in the military?
Well, Brent, that's a great question. We know very clearly now that our military personnel face some unique considerations related to brain injury, and that brain injury has been identified as a signature injury of our current conflicts. In fact, in this war, the rate of brain injury is higher than any previous wars that we have been involved in. And some of the reasons for that really have to do with the multiple mechanisms that brain injury can be sustained for our veterans. And most importantly, this war, these conflicts have really seen the increase of bombs and explosions and IEDs. And we know that those explosions are a dynamic event. Once there is an explosion like that, there are multiple forces, pressure waves that pass along and pass through the body of someone who may be in the way of those waves. And as those waves pass through the body, traveling faster than the speed of sound, so you will get hit with those waves before you even hear the explosion. As they pass through the body, they can cause damage, particularly to organs that are air-filled or have different densities of tissue. So the lungs, the ear, the tympanic membrane is very susceptible, the GI tract, the brain. So there's multiple waves that pass through that can cause injury. There are also several other ways that explosions can lead to a brain injury. The blast may actually throw debris at someone, carry debris that may strike the individual. The blast could pick the individual up and throw them up against something. So very often there are multiple avenues. If you can imagine someone driving in a Jeep, there is an explosion. The shock waves pass through the individual, causing damage potentially. The individual may then, the vehicle may lose control and have an accident which could cause a brain injury. The troop may then get out of the vehicle and fall, which could cause a brain injury. So these are some of the unique challenges that our veterans and troops have faced, and really a reason why we have such an increased incidence of traumatic brain injury.
Tom, is it true we're seeing more incidents of these sorts of injuries because our soldiers are surviving them more than they used to?
That's an excellent point. We have been very fortunate to have both exceptional equipment and an exceptional response time to injury on the battlefield. And this has clearly led to troops surviving injuries that in previous conflicts would have been fatal.
Mm-hmm. So is there a need for greater expertise as far as the military doctors themselves in dealing with these sorts of injuries?
Well, I think initially it caught us off guard. Our armed forces, the Department of Defense, and the Veterans Administration, we weren't prepared for this type of injury to be the signature injury, and it did catch everyone off guard. But there has been a huge response from persons in the country, the government, and these entities to address it. And now I think much is being done. One of the areas that we really need to focus on now is not only the assessment and acknowledgement and immediate treatment, but long-term care. That's an area where we are a little weak and we need to turn our efforts towards.
Tom, what can a veteran with a TBI expect once that person is discharged from the military?
Well, there certainly are supports that are put in place now. Some of the problems are that the military life is very structured. It has a lot of routine, and structure and routine can go a long way in obscuring the consequences of a brain injury. So when you do the same thing over every day, you're told where to go, and someone is there to provide direct feedback to you, the consequences of your brain injury may not be recognized. And once they return home, these injuries may become much more apparent and cause problems then. So there are services in place, but it may be that many of the veterans are not being diagnosed with this condition and don't know they have it. And also the comorbidities. Many of our troops who have a brain injury also have other conditions such as post-traumatic stress disorder to address.
Mm-hmm. And Tom, what are some of the supports available to a veteran once they are discharged?
I think a big push now is really being focused on the education. Very often the family members are the ones who identify that there's something going on. It's very difficult to know what is normal recovery and reintegration when I've done 5, 6 tours of duty and I'm trying to return to my community, and what is abnormal, what might be a brain injury, what might be post-traumatic stress disorder. So education is critical, and we understand that it must be provided to the families, to the troops, and to the persons who work with our military providers, and that is, I think, a really good starting point.
And Tom, you mentioned the family, and when a soldier has a TBI, that affects more than just the soldier, but also the entire family, isn't that right?
Most certainly. This has been very clear. As I said, very often it is the family that identifies that there's been changes, and it's very difficult sometimes for the service member, the veteran, to recognize that there's been these substantial changes and to know where to go and what to do. And we're finding that many family members are the ones who are pushing their loved one, the veteran, for services. But clearly, you know, coming home with a brain injury or post-traumatic stress disorder, particularly if you were not provided education or support, can lead to behavioral and psychological changes for the family members. And so this is a big concern.
All right, Tom Martin, thank you very much for being with us.
Well, thank you for having me. I appreciate it. Thank you.
And thank you for watching this interview on Veterans and TBI, a service of the Brain Injury Guide and Resources.